First aid tips for parents, part A. What if your kid started choking right in front of you? Or what if they grabbed a really hot pan or their face started swelling up out of nowhere? Would you know what to do? In these situations, there's no time to Google and there's no time to freeze. You've got seconds and what you do next matters. In this video, we're breaking down 5 must-know first aid tips for parents, including choking rescue, burn treatment, allergic reactions, nosebleeds, and splinters. Clear, simple, life-saving, guys. Let's get into it. Choking rescue for parents in infants and kids. If your child is choking but still awake, here's exactly what to do and why it works. For infants under 1 year old, lay your baby face down on your forearm, head lower than the chest. Give 5 firm back blows between the shoulder blades and flip them over. Then give 5 chest thrusts with 2 fingers on the center of the chest. Never use the Heimlich maneuver on a baby, guys. It's just too risky for their tiny organs. For kids over 1 year old, you're going to want to stand or kneel behind them. Make a fist, and just above the belly button, you're going to give quick upward abdominal thrusts. This is the Heimlich maneuver. This creates a burst of pressure like a super strong cough, basically to pop that blockage out. And after any choking episode, even if your child seems fine, please get them checked by a doctor right away at the ER or at the clinic immediately. These tips are educational, but nothing beats real hands-on CPR training. I cannot stress that enough. Always practice with a prop, not a real baby. And if your child is unresponsive or not breathing, please call 911 right away and start CPR. Burn first aid for parents. If your child is burned, here's exactly what to do and why it works. First, always get your child away from the source of the burn. Next, run cool, but not cold water over the burn for 10 to 20 minutes. This is the gold standard recommended by burn experts, including the American Burn Association and Red Cross. But why? Well, cooling the skin right away stops the burning process, eases pain, and helps protect deeper tissue. Here's what not to do. Skip the old home remedies, guys. Never use ice, butter, toothpaste, or oils. Ice can further damage the skin, and greasy substances like butter or toothpaste actually trap heat, which makes burns worse and increases the risk of infection. Even though these myths are common, they can cause real harm. After cooling, gently cover the burn with a clean gauze or cloth. If the burn is larger than your child's palm or is on the face, hands, or genitals, seek medical attention right away. Go right to the ER. Always watch for signs of worsening pain, blisters, or infection, and call your doctor if you're worried. Remember, these tips are educational. Nothing beats real hands-on first aid training. Always practice on a prop, not a real child. Allergic reaction first aid for parents. If your child suddenly breaks out in hives, swelling, or has trouble breathing, you have to act fast. Here's what to do. For mild symptoms only, we're talking about rash or mild itching, you can use things like Zyrtec, cetirizine. You can use Benadryl, diphenhydramine, or Claritin, loratadine if that's what you have. This is good for kids 6 months and above usually. Zyrtec works fastest and is usually preferred for sudden hives. Benadryl also works quickly, but it can make kids sleepy. Claritin is less sedating, but it's slower and not quite as strong as Zyrtec for acute reactions. You can also use Pepcid, which is famotidine. I know it seems weird, but it's safe to use with any of these antihistamines and can also help reduce swelling. But if you see lip, tongue, throat swelling, vomiting, trouble breathing, coughing, wheezing, this is a severe allergic reaction, also known as anaphylaxis. Here's what to do. You want to use an epinephrine autoinjector right away, like an EpiPen, or there's one called AviQ. And you want to inject into the outer thigh, through clothing if needed. Some injectors like the AviQ even talk you through each step. After and even during, you want to call 911 immediately, even if your child seems better after the shot. If emergency help isn't available or can't reach you quickly, get to the nearest hospital as fast and safely as you can. Remember, those EpiPens, they buy you time. You still need to go to the hospital. All right? And why? Epinephrine acts fast, but again, it only buys time. The reaction can come back and more care may be needed. Every child needs to be checked by a doctor after any severe allergic reaction, no matter how they look after the shot. And antihistamines like Zyrtec, Benadryl, Claritin, and Pepcid can help with the itching and swelling, but they don't replace emergency care for anaphylaxis. Follow for more first aid skills every parent should know. Nosebleed first aid for parents. Nosebleeds are common in kids, especially in dry weather, allergy season, or just after nose picking. If your child's nose suddenly bleeds, follow these steps. Number 1, sit them upright and lean slightly forward. Never tilt the head back. This prevents the blood from going down the throat when you lean them forward. Number 2, pinch the soft part of the nose, not the bridge, and hold firmly for 10 full minutes. Okay, set a timer, don't peek at it. This is what actually stops the bleeding. Number 3, let them breathe through the mouth, and you can use a tissue to catch those little drips. If you want, you can place a cold pack on the bridge of the nose while you pinch, but it might help a bit, but nothing is better than pressure. Pressure is what really works. After the bleeding stops, just gently clean up. Be very careful. And look, to prevent future nosebleeds, keep the nose moist with saline spray or a dab of Vaseline or coconut oil inside the nostrils, especially in dry weather or if using AC or heaters. A humidifier in the bedroom can also help too. Keep your child calm and avoid nose blowing, picking, or rough play for a couple of hours. Anything that raises the blood pressure in the nose can break the clot and restart that bleeding. What if they have pain or discomfort? Tylenol is the safest. Avoid ibuprofen and aspirin as they can make the bleeding worse. For adults, alcohol and blood thinners can also make nosebleeds harder to stop. All right? So if the bleeding hasn't stopped after 2 rounds of 10 minutes, or if it's really heavy, call your doctor or go to the ER. For more first aid skills every parent should know, please subscribe to my channel. Splinter first aid for parents. Splinters happen to every kid. Here's how to handle them safely. Number 1, wash your hands and your child's skin around the splinter with soap and water. If you have clean disposable gloves, wear them for that extra protection. Number 2, use the cleanest tweezers you have, please. Wipe the tips with rubbing alcohol if you have it, or wash with soap and hot water, then dry with a clean towel. And look, liquor like vodka, it's not usually strong enough to sterilize. Use rubbing alcohol or really good washing with hot water. Number 3, only try to remove splinters you can clearly see and easily grip from the outside. Then pull that splinter out in the same direction it entered. Number 4, if it's hard to remove, soak the area in warm water for like 10 to 15 minutes to soften the skin, and then try again. Number 5, after the splinter's out, clean the area again with soap and water. If there's a small cut or a break in the skin, pat it dry, apply a little antibiotic ointment if you have it, and cover with a clean bandage. Remember to change that bandage daily or if it gets wet or dirty. And look, if the splinter is really buried in there but it's not causing pain, redness, or swelling, just keep the area clean and just watch it. Most tiny splinters work their way out on their own. If it's deep, not visible, under a fingernail, painful, swollen, or looks infected, please don't try to dig it out at home. Call your doctor, go to the ER, or go to the urgent care. And here's what to avoid. You never want to dig with needles or sharp objects. This can push the splinter deeper in and cause infection. And what about pain and swelling? Well, Tylenol is the safest. Avoid ibuprofen if there's any ongoing bleeding. It's just going to make it worse. And here are some key prevention tips for your kiddos, or yourself really. Have kids wear shoes outdoors, especially on wood decks, piers, playgrounds, and boardwalks, which is pretty much where I got all my splinters, were like wooden boardwalks. These are like classic splinter zones. Check wood benches, picnic tables, and home furniture for rough spots, and remind kids not to slide their hands along wood railings or surfaces. That's just not a good idea. Follow for more first aid skills every parent should know. Dr. Merchant out. Thanks for watching. I'm Dr. Merchant, and every week I share videos to help parents with the stuff that really matters. Medical tips, parent hacks, and how to actually use tools like GPT to make life easier. So if that sounds helpful, hit subscribe and don't forget to tap the bell so you don't miss the next one. And if you have a question about health, parenting, or just life stuff you're working through, drop it in the comments. I read every single one, and yours might be the next video. While you're here, check out these other videos. They should be popping up somewhere. And listen, whether you're a parent, a patient, or a professional, I'm here to help you figure things out and take the next step, one video at a time. Dr. Merchant out.